This article for Family Process is what I've called 1.5 order therapy. And by that, I mean the space between first and second order therapies. And by that, what I mean is the more traditional practices of expert therapy, where therapists knew a point of knowing, and the second order shift, a space more likely to be not knowing, or more collaborative and conversational therapies. So the tension perhaps between those two positions, which I found myself to be shifting between more often, more lately than previously. In a sense, if you will, it's doing first order therapy in a second order way. The article explores challenge, interruption, and directive therapy, which is a move away from how I worked for many years when I was more influenced by the collaborative approaches of Tom Anderson, Harlan Anderson, Michael White, and others. And a more collaborative approach is what I favored for many years. This seemed to work really well. But then something happened. I got older, more confident, more experienced, and I started to question these practices and realized I actually do know a lot of things, like any experienced therapist would. And so how to include these in my practice became the question. That's what 1.5 order is about. I refer to some examples of this. I refer to a thing I've called embedded questions, by which I mean our questions don't come from nowhere. Our questions mean something, and it's for us to understand those meanings. So examples of this might be, if I ask a client, do you think your mother understood you just then when you said that? I probably mean, I don't think she did. Or I might ask, do you think your husband will ever be the man you want him to be? By which the embedded meaning for me is, I'm not sure he will. Or I might ask, if you thought of your son's behavior as a protest, what might he be protesting against? By which I probably mean, I think he is protesting about something, and it would be really good if you could understand what that is. Other examples I give are things like a thing I've called, the thing is not the thing, which for me is an attempt to move away from detail and more towards themes or meanings of what people bring us. One of my beliefs is that detail, excessive detail, is the enemy of therapeutic endeavor. So ways in which we might help people move away from detail and examples and more towards the actual meaning or the theme of the thing that they're bringing. Another example is, when you win, you lose. So these things are explained in the article, along with many verbatim examples from therapy itself, which I hope is useful to people, and I hope are transferable and you can use them in your practice or be interested in them, and perhaps in the teaching of family therapy for those of you who teach, that can also happen. So in a sense, this is about many things. It's about therapeutic relationships, how we work with people, still in respectful and collaborative ways, but embrace our knowledge and our expertise and the evolution, perhaps, of ourself in therapy, which is an endlessly interesting and important topic for me. So I hope you find the ideas in it useful, and I'd be very happy to hear from you at the address at the bottom.